Hello, everyone. My name is Wei Zhang. I'm a neurologist. I worked in First Hospital Peking University in Beijing and thank Fabry International Network to give me this opportunity and share my experience on this topic, the dizziness and vertigo in Fabry disease. And first, I will give a brief introduction to Fabry disease. And we know that Fabry disease is a X-linked lysosomal storage disease. It is caused by GLA mutation. This mutation will lead to the decreasing of the alpha galactosidase A activity, and the decreased enzyme activity will lead to the deposit of the GB3 in various cells and finally lead to the clinically the multi-organ involvement, uh, including the brain, the heart, the kidney, the eyes, and these multi-organ involvement will show in the clinically multiple symptoms. They will start from very early stage and developed according with the disease duration. And today we will talk about the dizziness and vertigo. And actually, dizziness and vertigo is not very rare in Fabry disease. They can start in the very early stage. From this picture, we can see that dizziness and vertigo are one of the six major signs, the early signs, in the childhood. It can start as early as 4 years old. So next, I will give a summary for the dizziness and vertigo. And actually, dizziness and vertigo is very common in the neurological clinic, and they account for about 5% of the clinical patient. But their causes are not well explained, even in the patient without Fabry disease. And the vertigo, this word, is more specified. It just describes the sensation of movement between the patient and the environment. And the patient will frequently describe this feeling as spinning, swinging, tilting, or unsteady, unbalanced. And often the patient suffer from the vertigo will accompanied with nausea, vomiting, sweating, and generalized unwell feelings. Based on the location of the vertigo symptoms, vertigo can be classified into two categories. And the first is the peripheral vertigo. It's very common actually. It will be related with the vestibular system and the related structures in the peripheral part. And the second one is the central vertigo. That means the lesion located in the central nervous system, just like the cerebellum, like the brainstem, and sometimes the cerebral. And next, we will talk about the dizziness. Dizziness is just different with the vertigo. It's a more widely used word and more global term. And also, it has a very wide meanings. It can be referred to as lightheadedness, fuzziness, or just an overall sensation of not being very well, not being so really clear. And it's the dizziness, is not well located. It can be caused by multiple reasons and very complicated status. And the types of the dizziness, usually people will just describe the dizziness into four groups. The first group is just as we refer to as vertigo and a false sensation of motion, just related with the vestibular peripheral system. And the second group is just disequilibrium. That can be described as unsteady gait or imbalance. It's related usually with the lesion in the brain. And the third group is kind of feeling of losing consciousness or blacking out. It can be defined as a pre-syncope. And pre-syncope usually related with the decrease of the regional blood flow in the brain. And fourth, the last one, can be described as psychogenic vertigo or psychogenic dizziness. And it's just lightheadedness, very complicated feeling with some mood disturbance like depression or anxiety. And when we go back to Fabry disease, what's the causes or the possible etiology of the patient, Fabry disease patient who suffering from the dizziness or vertigo? And when we see from this picture, we can see that multiple organs are involved in Fabry disease. But among them, I think the peripheral and central nervous system can be the major reason for the dizziness and vertigo. And another is the heart, the cardiovascular system are also involved in the development of these symptoms. And the Fabry disease patients can suffer from all the four groups of the dizziness. And first, I will talk about pre-syncope, the third one. That means the pre-syncope can be related with the change in the heart rate and then lead to the change in the blood pressure. And finally, the change in the RCBF will be related with the clinical the symptoms, a kind of dizziness, just like the before the development of the unconsciousness or a kind of blacking out feeling. And when we talk about this type of the pre-syncope, this type of the dizziness, I will just start with the peripheral nerve system involvement in Fabry disease. And we know that peripheral nerve system can be involved in a very early stage, and also it is very common. The major clinical presentation is small fiber neuropathy. That means the patients will suffer from the deficit in the sensation and the autonomic function. And this is the main symptoms in the small fiber neuropathy. And actually, we are very familiar with the neuropathic pain and also the gastrointestinal symptoms, also the sweating disorders, and sometimes the sexual disability. And when we talk about the pre-syncope, this kind of the dizziness, that means the dizziness will be related with the peripheral nerve neuropathy, especially the peripheral sympathetic activation defect and the related vascular autoregulation defect. Is related with the adult and type C fiber neuropathy. And I will try to explain this kind of the dizziness in this picture. And clinically, we can see in the Fabry disease patients who suffer from the dizziness and during the examination, especially the tube test, we can find the orthostatic tachycardia, orthostatic hypertension, and also just the hypertension. But why? In a patient with dizziness, these situations usually start with a small fiber neuropathy, and the peripheral neuropathy will lead to the peripheral sympathetic denervation. And this kind of degeneration will cause the peripheral vessel dilation and finally lead to the decreasing of the preload. If our heart, the patient heart, kept intact, we can see clinically in this patient the compensatory heart rate elevation. That means the postural orthostatic tachycardia, the pulse. However, if the patient, in this patient, the heart, something happened in the heart structure involved, destroyed. the heart cannot compensate, it will lead to the orthostatic hypotension. Usually, it will develop in the relatively late stage in the patient. And also, some researchers just provide some other explanation for this phenomenon. They will think the GB3 will deposit firstly and primarily in the heart cells. This will lead to the cardiac autonomic system involvement and lead to the abnormally sympathetic activation in the heart. And also, this kind of the activation also can cause the increase of the heart rate and the related dizziness. And this is two examples from our patient. The first one, upper one, we can see in middle-aged male patient, the classic Fabry disease patient, and he suffered from the recurrent dizziness. And in this patient, in the tube test, I found the orthostatic tachycardia, the pulse. And in the second patient, a younger male patient, also the classic Fabry disease, and clinically, this patient suffered from the dizziness and just one time the syncope. And during the examination of the tube test, I found orthostatic hypotension. And these findings can explain why the patient suffered from the recurrent dizziness. And the next group of the dizziness, I will talk about the vertigo. And vertigo is also very common, and it's a kind of false sensation of the motion, just I refer to and explain it. And it's related with the imbalance in the vestibular system. And clinically, in Fabry disease patient, the vestibular system involvement is very common, and we can find in the patient cochlear vestibular system involvement in the very early stage. And clinically, the patient will show the asymmetric hearing loss, the tinnitus, and also the vertigo. And the patient, just half of the patient will suffer from the vertigo. And sometimes both of the hearing loss and the vertigo in about 1/3 of the patient. And both male and female patient during the examination, we can find the very high incidence of the vestibular loss. And statistically, we can see that the vestibular loss related with increase with a higher age and also very high in the male patient. And after the ERT, we can see the stabilizing of the hearing loss and also improving of the vestibular function. And that's the two major groups of the dizziness. And I will next talk about the third one, the disequilibrium. That means the aesthetic and patient will just frequent falling, also sometimes the feeling of the imbalance. It will be related mostly with something in the brain, like in the cerebral system, and also some lesion in the brain stem. And sometimes it's very rare in the spinal cord, in the posterior tract, also can develop such clinical symptoms. And so in the brain, first I will talk about the strokes in the central nervous system. We know that brain is involved in the about adult stage in Fabry disease. And according to Fabry registry, we can find just the incidence of strokes around 5.5%, and both in male and female patients. And male patients, it starts around 39 years old. In female patients, it's about 5 years later. And clinically, just like I show in the right side of the two pictures, both the small vessel disease in the MRI, the upper one, and also the large vessel cerebral vascular disease, the lower one, These two major types also can appear, both can appear in patients with Fabry disease. And both these two types of the cerebral vascular disease will present as dizziness or vertigo, especially in the recurrent attacks. And this is also example from our patient. It's a 29 male patient, classic Fabry disease. And one time he just suffered from the vertigo and dizziness and aesthetic about 3 days and then vomiting and cannot just walk around. And during the MRI examination, we found in this patient the infarction, multiple infarction in the brainstem, also in the cerebellum, also in the left occipital lobe. And all these lesions just located in the posterior circulation. But why? Why the patient suffer from the posterior circulation infarction? And that's one of the explanation. These two pictures also from our patient, we can see the elongation of the vertebral basilar artery. And also in this patient, later he developed the infarction in the brainstem. And its explanation for this phenomenon is during the examination, they found a higher blood flow velocity and a lower resistance index in the VBA. So the posterior circulation could be more prone to vascular lesions and perfusion deficit. So let's come to the fourth type of the dizziness clinically. And in this group, it's very special and it's just described, not very clear. Patient will just complain about lightheadedness, very complicated feeling, and most of the time just accompanied with the mood disturbance like depression, like anxiety. So let's just go back, talk to the central nervous system disorders. Besides the stroke, there is also cognitive decline or even dementia, and also the mental disturbance, depression and anxiety is very common. And sometimes the sleeping disorders, the epilepsy, the headache can appear or can be found in the central nervous system disorders. And depression and anxiety just shows the very high prevalence in Fabry disease. It's about half of the patient. It will be related with ischemic stroke, related with the recurrent and very severe pain in the early stage, and related sometimes with physical discomfort and even with social reasons. And we also found the patient suffer from the depression and anxiety will be very easy and very common to develop the dizziness or vertigo. And actually, there will be finding that there will be a reciprocal relationship between the vestibular and the psychological disorders in patients with Fabry disease and even without Fabry disease, both two groups. The patient with vertigo and dizziness and the higher risk of the various psychiatric problems. On the other hand, the patient with mood disorders are also at a higher risk of experiencing vertigo and dizziness. So that's the four major groups of the dizziness and the four major reasons of the etiology in the Fabry disease. But just as I talk about, besides the central and peripheral nervous system, we also care more about some other organs, especially the heart. So the cardiovascular events also can involve the patient, and such patient can also suffer from the dizziness and vertigo. So the etiology of the mechanism also related with the pre-syncope. The change in the heart rate in the blood pressure will lead to the change in the regional cerebral blood flow, and finally lead to the clinically the feeling of unconsciousness. And what can we find in the part in the patient with Fabry disease? We will find hypertrophic cardiomyopathy, valvular disease, arrhythmia, the coronary heart disease, the chronic heart failure, the hypertension and hypotension. And we are familiar with these heart disorders, and all these disorders can lead to the increase or decrease of the blood pressure, especially the decrease of the hypotension. It's very common. And finally, will lead to the regional cerebral blood flow decreasing and lead to the clinically pre-syncope or syncope. And in this picture, I will just focusing on the hypotension. We know that heart disease can cause the hypotension, but on the other side, we need to also care more about the medication-related hypertension, especially when the patient suffer from the proteinuria. The patient will just was medicated with ARB or ACI, and all these drugs can cause the hypotension and might be sometimes related with clinically the dizziness. So that's all the reason of the clinical presentation and the possible etiology of the dizziness and the vertigo in Fabry disease patient. So I will summarize. The Fabry disease patients show the high frequency of dizziness and vertigo. The cochlear vestibular system and the autonomic nerve, brain, and heart are all involved in the development of the dizziness and vertigo attacks. So the prompt recognition to the potential causes will be very important in the protection of these organs. So the final picture, the upper picture is from our patient, and the lower one, the three photos are from our groups in the first hospital, Peking University in Beijing. And last, thanks for your listening. Thank you.